Dr. Ominde, and I'm going to discuss the anatomy of this lecture, introduction, the posterior abdominal wall, retroperitoneal structures, including the kidneys, adrenals, the vessels in the retroperitoneum, as well as the nerves in the retroperitoneum. So, the abdominal cavity generally has spaces, okay, and it's a space that is bounded by the anterolateral abdominal wall anteriorly. Posteriorly, you have the posterior abdominal wall. Superiorly, there's the thoracic diaphragm, and inferiorly, you have the pelvic walls and pelvic floor. So those are the boundaries of the abdominal cavity. And the abdominal cavity is divided into a true abdominal cavity. This is from the diaphragm to the linea terminalis, and you have the pelvic cavity below the linea terminalis. Then we have the peritoneal compartment, which deep illustration is in the lecture on peritoneum. Just remember, it's a continuous serous membrane with an outer parietal peritoneum on the abdominopelvic wall and an inner visceral peritoneum that usually lines the abdominal and pelvic organs. So the peritoneal compartments are within the abdominal cavity and they are enclosed by parietal peritoneum. So you have organs that are covered with peritoneum and other peritoneal structures. So those are peritoneal organs, and those organs that are outside the parietal peritoneum, that's what we refer to as extraperitoneal organs. They're within the extraperitoneal compartment of the abdominal cavity. So usually the peritoneum surrounds the between the parietal and visceral peritoneum. You have peritoneal cavity that contains peritoneal fluids, but you have structures or organs that are surrounded by peritoneum, like the liver, stomach, ileum, and jejunum. However, we have some organs that are behind the peritoneum, and that space behind the peritoneum is a retroperitoneal space. So we have organs that are primarily retroperitoneal. Yeah, they were never within the peritoneum or covered by peritoneum. These include the kidneys, bladder, and the ureter. However, we also have secondarily retroperitoneal glands. This means that these glands usually migrate posterior to the peritoneum during embryogenesis. So they are not retroperitoneal initially, but during embryogenesis, they migrate posterior to the peritoneum. So they are secondarily retroperitoneal, and they lack mesenteries. These include the duodenum, part of the duodenum, ascending and descending colon, the rectum, and the pancreas. So these are secondarily retroperitoneal glands. Now, the posterior abdominal wall is mainly formed by, you have retroperitoneal organs posteriorly, but the posterior abdominal wall is mainly formed by quadratus lumborum muscle laterally and the psoas muscles at the medial aspect. But these are the structures in the retroperitoneum: the kidneys, the ureter, there is the inferior vena cava, the aorta and its bifurcation into common iliac vessels, and so on and so forth. So the posterior abdominal wall also contains the diaphragm. Again, there's a whole lecture on the diaphragm, so you need to go through it because you can be asked to write an essay on the thoracic diaphragm. So the diaphragm, again, this is the diaphragm here, musculotendinous structure that separates thoracic cavity from abdominal cavity. It has an lateral and medial arcuate ligament. This is medial arcuate ligament from psoas major and lateral arcuate ligament from the quadratus lumborum. Then we have a median arcuate ligament that is found around the aorta. So median, then medial from psoas, then lateral from quadratus lumborum. The diaphragm has two crura. So the right crus contains the esophageal opening, and that's at the level of T10. And there's also a left crus. So the diaphragm has three apertures. At T8 is the aperture for the inferior vena cava. At T10 is the esophageal hiatus, and T12 is the aperture for the aorta. And the diaphragm is mainly innervated by the phrenic nerve that gives motor and sensory innervation, but there's also participation by the intercostal nerves that innervate the lateral aspects. The central portion is by phrenic nerve. The muscles of the posterior abdominal wall include the quadratus lumborum, the psoas major and psoas minor, as well as iliacus. Okay, This is iliacus. The psoas major, this is your quadratus lumborum on the lateral aspect. Retroperitoneal structures are quite a number. So we have some vessels such as inferior vena cava with the gonadal vessels draining into them, such as testicular vein in males and ovarian vein in females. Then we have aorta and its branches, the lumbar sympathetic chain, celiac ganglia, the kidneys, the ureter, the adrenal gland. So these are the retroperitoneal structures. So we'll start by discussing the kidney. The kidney is a retroperitoneal organ. It's in the superior part of the lumbar region. It extends from T11 to L3 or T12 to L3 depending on the side. Okay, remember the right kidney is lower than the left because the liver is above the kidney. So it tends to sort of push the kidney lower. So the right kidney, the liver is mainly on the right. So the right kidney is lower than the left. Okay. So that means the origin or the extent of the right kidney superiorly is lower. So it's at T12 to L3, while the left kidney will extend from a higher level T11 to L3. So the kidneys have a medial concave side and a lateral convex side. And the kidneys are the size of the length of 3 vertebrae. Okay, they are the size of the length of 3 vertebrae. And the hilum of the kidney contains blood vessels, nerves, as well as the ureter. And really, the arrangement of these structures, the renal vein is the most anterior. You can be asked what's the order of arrangement. The renal vein is the most anterior, followed by renal artery, and the ureter is the most posterior structure at the hilum, the ureter. We have the adrenal gland that lie on the superior poles of the kidney, and they're also enclosed. They are enclosed in a separate envelope of the renal fascia. What are the functions of the kidney? You can appreciate the kidney here. This is the ureter. These are the blood vessels. Fluid balance. Okay, there is absorption of fluid. There is filtration of toxic waste, excretion of waste, electrolyte balance because you absorb sodium, you release some hydrogens, and so on and so forth. Vitamin D metabolism, as some part of it occurs in the kidney. The juxtaglomerular cells produce erythropoietin, which helps with red blood cell formation, so that's erythropoiesis. So there are many functions of the kidney which you need to be able to describe in detail so you can revise from your physiology notes on how the kidney performs fluid balance, electrolyte balance, vitamin D metabolism, and so on and so forth. So we said that the lateral margin is convex and the medial margin is concave. The hilum has the blood vessels, entry and exit of neurovascular structures. Then we have a renal sinus. This is the cavity at the medial border for the hilum. So this cavity here, this concavity is the renal sinus. Anterior surface of the kidney is curved while the posterior surface is flat. So anterior surface is curved, you can see, but posterior is flat. And the kidney has an upper pole and a lower pole. So what's the gross anatomy? We continue the gross anatomy of the kidney. So what are the coverings of the kidney? So from the kidney, we'll describe it like you need to appreciate here first. This is the kidney. Then we have perinephric fat here before you get to the renal fascia. Okay, that joins to the transversalis fascia. After the renal fascia, you get to the paranephric fat. So you need to be able to know that order. So kidney has its own capsule before you get to perinephric fat, then renal fascia. Then around the renal fascia is where you have paranephric. Okay, again, just for you to appreciate, this is Gerota's fascia, which is the fibrous tissue, and there's fat layer below the Gerota's fascia. Appreciate the renal pelvis here. Again, the kidney has its own capsule, followed by perirenal fat, then the renal fascia, then the pararenal fat. So those are the coverings of the kidney in that order. You need to know them in order. So we start with the capsule of the kidney. It's tough and fibrous and usually fuses with the surface of the kidney, and it's usually removable. Then after that, you go to the perirenal fat. This is just part of the extraperitoneal fat. Then from there, you move to the perirenal fascia, which is the Gerota's fascia. Perirenal fascia is the gyrotous fascia. It's fibrous and separates the adipose capsule from perirenal fat. It usually encloses both the kidney and the suprarenal gland. Then pararenal fat pad. It's between the posterior layer of the renal fascia and the fascia transversalis. Usually, this pararenal fat pad is posterolateral to the kidneys. So again, this is your kidney. It has a capsule, then perinephric fat, renal fascia there, and paranephric fat. Okay, so we now proceed. The renal capsule, the perirenal fat, renal fascia, and pararenal or paranephric fat. So, what are the relations of the kidney? Posteriorly, you have the diaphragm, the quadratus. This is the diaphragm, quadratus lumborum, psoas major muscle. Okay, at the superior poles, you have the adrenal glands above the kidneys. What are the anterior relations of the kidneys? On the right and the left, it varies because the structures on the left are not the same as on the right. So what is anterior to the kidney on the right? There's a liver that sits here. There's the duodenum and part of the large intestines, the transverse colon and the hepatic flexure. While on the left side, you have the stomach that usually rests here. Remember, these are the structures on the stomach bed. So you have the stomach that rests in this portion. There is the spleen around this area here. Then the large intestine, transverse colon, and splenic flexure, and some part of the small intestines, because this is the duodenojejunal junction. So some part of the small intestines are anterior relations of the left kidney. So you need to know the relations of the kidney in detail, and this slide actually talks about it. So this just shows you that different structures are around the anterior aspect of the kidneys on the right and the left side. So you can see the 11th rib is here, the 12th rib, transverse abdominis, quadratus lumborum, and psoas major. So these are the posterior relations of the kidney. Okay, so you have the ribs, you have the diaphragm, you have posterior abdominal wall muscles such as quadratus lumborum and psoas major, and you have neurovascular structures such as subcostal neurovascular structures, iliohypogastric and ilioinguinal nerves. So these are the posterior relations of the kidney. What of the anterior relations of the kidney? On the right, on superior pole, you have suprarenal glands, but on the right, you have the liver occupying most of the space. This is where the duodenum rests. This is the colon, this for the small intestine. So when you come for your viva and we give you the organ, the kidney, we'll ask you to show where the liver grooves, where the duodenum grooves the right kidney, where the small intestine. So you need to know where each structure grooves. You need to be able to identify the kidney. Is it a right or a left kidney? So the concavity should be medial, convexity should be lateral. Then you put it in anatomical position. Anterior surface we've said is curved, posterior is flat. Then look at the structures at the hilum. The ureter has to point downwards, and the ureter is the most posterior structure. Renal vein is the most anterior, followed by renal artery, then the ureter. So the left kidney anteriorly is grooved by the stomach here, the spleen towards the side, the pancreas towards the hilum, the small intestines around this area, and on the edges you have the colon. So during your viva, you should be able to state the structures that groove the different parts of the kidney. This is just a repetition: liver, duodenum, the colon, and the small intestines, the spleen on the left, the stomach here, suprarenal glands of the poles, the pancreas rests here, coils of the small intestines, and the splenic flexure there. So this just shows you where you can locate the kidneys. These are the kidneys, these are the calyces, minor and major calyces forming renal pelvis and the ureters. So it's just showing you the relation of the kidneys with the vertebra, T vertebra and the lumbar vertebra. And these are the kidneys. From posteriorly, you can actually get the surface landmark of the kidney. So that's where they are located. So what are the internal features of the kidney? So from the capsule, you have an outer cortex and an inner medulla. So the inner medulla. So the outer cortex, this is the cortex. The cortex sends in extensions towards the medulla as renal columns. So the extensions are renal columns. Then the medulla is made up of the pyramids. So these are the renal pyramids that converge to the renal papilla. So cortex with columns, and medulla has pyramids that converge to papillae. Then from there, urine drains into minor calyces. Minor calyces join to form major calyces. Major calyces join to form renal pelvis. which is the dilated portion,